the Step 2 CK.
Oh, really?
So there's only a couple places in the country, whereas like the clinical skills,
Uh-huh.
I mean the written test, you
Uh-huh.
can take it prometric, but the other one you have
Yeah.
to go and perform, and it's only at certain places across the country.
Oh.
So it's kind of more timing, but they're two very different tests.
Yeah. So it doesn't matter which one
I
you'll
don't think
do.
so.
Okay.
I mean,
How about you? Which one you did first?
I did Step 2.
Oh, step 2.
Step 2, the written test first.
The written
Yeah.
first. Okay. Okay. How about, is it true about what she reads about matching? Like couples matching? Is that true?
Yeah, you can do a couples match.
Because my sister has a boyfriend which is same of her level. They're both MD in the Philippines.
Okay.
They're planning this together. And they're just reading and watching some blogs about matching. But they aren't sure if it's
Yeah.
real. That like they said it's the higher percentage to be accepted or get some visa if it is a couples match, something like that.
Oh, really?
I don't know. She's just asking about that.
But
But they can do it, something like that.
they can do a couples match for sure. The challenge becomes, I mean, no one really knows exactly how the match algorithm works.
Oh.
That's the problem, is so you can't really give a definitive answer.
Okay.
But so if they do couples match, then basically they have to both match at that given program. And so let's say one of them is a much stronger applicant,
Mm-hmm.
it will likely hurt
The other
the one that's a stronger applicant, and it will help the person that's like a less strong applicant. So it can only hurt, I mean, if you're an excellent applicant and your significant other is not,
Mm-hmm.
then it can only hurt you.
What if both of them will choose peds? Something like that.
If both of them choose peds.
Uh-huh. Or both of them have the same, it's by scoring, right?
It's score, and there's so many different
Oh.
factors, like what sub internships you've done,
Okay.
your scores, your step scores, and then how you've performed on clinical
Uh-huh.
rotations,
Oh.
which is challenging because if they should probably try and do a clinical rotation in the United States.
Mhm. She did one actually when she was before graduation. I don't know what do you call that one. She
Okay.
did one in Seattle,
Okay.
and then I don't know if you call that clinical rotation already.
Yeah. So was that her third year or which year of medical school?
She was already graduating with that one.
Oh, she had already graduated.
No, she is graduating med student
Okay.
when she did that one.
She'd already graduated from medical school?
No, it's like the last year of med school.
Okay.
I
How
don't
many
know.
years are there?
4?
And it was her fourth year?
Yeah,
Oh, okay. Where did she do it?
in Seattle.
At a
It's a clinic. Yeah, it's a clinic.
Yeah, unfortunately, I know obviously a bit, but it's so hard because it's a different ball game for
Oh.
international medical graduates. But I know that for IMGs, the scores are so much more important.
Oh, really? Okay, that's cool.
They've really got to, get good scores like on step 1 and step
Mhm.
2,
Mm-hmm.
like at least national average.
Yeah,
It's just challenging.
it's just sound. Okay.
But yeah, like something like peds or family medicine will be less competitive.
Okay.
Than obviously like surgery or something along those lines.
Okay.
And I feel like there's a lot of programs in New York that are very like IMG friendly.
She told me about New York actually.
So New York is very IMG friendly. So
Oh.
you definitely want to look at a lot of programs in New York. I know I have a friend that was from the Caribbean. She's
Mhm.
in Arkansas. So I
Mhm.
think some of these more places that are like less sought after
Okay.
are
Okay.
probably
I get it.
are probably a little bit
Maybe
easier.
most likely for new nurses too, that came from international places.
Yeah.
It's easier for them to get new hire jobs
Yeah.
in like those kind of places
Okay.
compared here.
Yeah.
Yeah, I get that one. Okay.
And our program used to be like very friendly to international medical
Oh.
graduates, but for some reason it's changed in the last 2 or 3 years.
Well, I already told her it doesn't matter where she gets that residency or something, or how do you call it, as long as she gets in,
Yeah.
and then she'll just think where to practice when she's done with that program.
That is the most important thing. Is just getting over that hoop of getting into the U.S. I think is the
Mhm.
most challenging part.
Okay.
I think it's so unfortunate how much weight is put on scores, but for MGs the scores are very important. I think it's good that she did a rotation here so that she can
Okay.
get good letters of recommendation.
Okay. I actually talked to Dr. Reyes.
Oh,
and
really?
she said it's okay for observership. That's how you call it too.
Yeah.
Yeah, she said okay. When my sister is ready, she could.
Oh, she wants to come here
Um,
for like a wait.
At first, I really don't know what to ask. And then
Yeah.
one time I talked to my sister so she could enlighten me on the process that you need to
Yeah.
like to go. And then one time she mentioned about observership, that she's looking for a doctor that she needs to do like a preceptorship or slash observership.
Yeah.
And then I just randomly work with Dr. Reyes because she just works like how many days a month, right? And
Yeah.
then we don't usually see each other that much. So I accidentally worked with her that time. And then I just asked her about that word, observership, which I really don't understand. And then maybe she understands what I'm asking because I told her my
Yeah.
sister is MD in the Philippines and want to take the USMLE. And she just mentioned, oh, if your sister is ready, just let me know. I could help her with her observership. That's what
Okay.
she just said.
Yeah.
So,
I mean, it's like it. Yeah. So it can be. I mean, ideally, it would be like a rotation where she's acting like a resident.
Oh, okay.
Observership implies that she's not doing anything. Like she doesn't get to touch. Like, she can maybe examine the babies, but
Okay.
she's not. She doesn't have computer
Is that
access.
part of the step 2? No.
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 Like there's a clinical rotation and an observership. Like
Okay.
an observership, she would just be like listening to rounds.
Okay.
She would maybe like follow patients, but she wouldn't be putting in orders. She
Okay.
wouldn't be doing procedures.
Okay.
Ideally, she would be doing like a clinical rotation, and she would have access from UMC to
Oh.
like touch the babies,
Okay.
take care of the babies,
Okay.
and then Dr. Reyes could then write her a stronger letter of recommendation
Oh, I get it now. Okay.
because she's acting like a doctor, right?
Mhm.
But if she's observing, it's kind of like
Different.
it's a different.
It's like a
way
shadow only,
it's
right?
Yeah, it's like shadowing.
Okay. I get it.
So ideally, she would do like a clinical rotation. But if Dr. Reyes could have her, that would be ideal because then Dr. Reyes could write her a letter of recommendation, and then a letter of recommendation coming from the United States holds more weight
Okay.
to like programs. So I think that would be the ideal situation for her.
Okay. What you've said to me is like, thank you very much.
No problem.
I hope I didn't annoy you. Okay.
Not at all. Not
Just
at
let
all.
me know, because
She
for
can
sure.
text me if she
Okay,
wants.
for
Yeah.
sure I'm gonna text you for more. Let me know if you're already done with explaining to me.
No.
Okay.
Not a
Thank you,
problem.
Nico.
Of course.